At the Swedish Multiple Sclerosis Center, we participate in a number of clinical trials. These trials investigate new agents that mostly target immunity. We're trying to find a good balance between efficacy and safety with different medicines and treatments in hopes of advancing the field and supporting that new discovery. We do have one of the largest multiple sclerosis centers in the region, and Swedish is emerging as a major player in new advances related to multiple sclerosis. Most of our patients, in fact, are diagnosed elsewhere, and then they come to us for a second opinion, a fresh set of eyes. They're looking for some clarity. They're looking for a definitive answer that this truly is MS and thorough advice what to do next. There are so many ways in which MS can affect one's life that a single physician rarely can provide that comprehensive care, but a center can. And that's actually why we have an MS center, because we realize that an MS patient needs more than a neurologist. They need a therapist, they need a counselor, they sometimes need a psychiatrist, a urologist. It is a process. There are treatments that allow us to manage the multiple sclerosis and make it less active, minimize the number of attacks, and reduce any sort of disability that results from MS. As we go through these routine visits and things change, we try to stay one step ahead of the disease. For all of these patients, it helps to know that they're not the only ones dealing with this. That in fact there are many other young people who are going exactly through what they're going through. MS is not the end of the world. That MS of today is not the MS of 30 years ago. And most important of all, that MS is different in every single patient. It's a changing field of neurology in that we can do more, and it will continue to change at an accelerated rate at least for the next 10 years. At Swedish Medical Center, we strive to provide the best possible care for our patients and allow them to live the best possible life in spite of or because of their disease.